Beyond Our Borders is brought to you by the Bank of Guam and KFC.
Howdy, everyone, and welcome to another edition of Beyond Our Borders. And it's my pleasure to welcome our guest this month, and it's Dr. Arturo De La Pena, who is the president and CEO of St. Luke's Medical Center at Bonafacio Global City here in Manila, Philippines, and also a distinguished surgeon himself. Welcome, Dr. De La Pena.
Thank you, Nestor, and half a day to all of the Guamanians.
I'm sure they're glad to hear from you, sir. As you mentioned, you've been to Guam several times pre-pandemic. Of course, right now the travel is a little bit more restricted. But the governor, Leon Guerrero, she recently announced that she is reopening travel to the Philippines for medical purposes, for specialized medical treatment. As effective, I think, earlier this month. So could you, first of all, sir, just explain to us what that entails, what sort of special medical treatment patients from Guam can avail?
Yeah, initially it is indicated for emergency cases wherein medical services that are not available in Guam and available here in the Philippines. What we do is we had an agreement with the governor of Guam, and we make all of the arrangements with the Department of Health in the Philippines, the Department of Foreign Affairs, and the consular office there. And we use the PhilMD office, our PhilMD office in Guam, to coordinate the travel of those patients who would need emergency medical services to the Philippines. And we have done that several times because their medical problems need immediate medical attention.
Yeah, and of course that would be the PhilMD. That would be Ms. Annette Garces and her team back in Guam. As you know, pre-pandemic, literally hundreds of Guamanians would travel to Manila for treatment at SLMC for varying types of treatment. Can you give us some insight into that and that arrangement that you've had with Guam for many years now?
Right now, before we used to get a lot of patients from Guam specifically for executive checkups and for medical services, specifically for surgical operations and other advanced medical procedures whose services are not yet available in Guam. During this pandemic, and we have also noticed among Filipinos, there were fear of going to the hospital. And that's the reason why many of the chronic diseases of Filipinos became more severe, and they will come to the hospital on an emergency basis. Like, for example, we used to get 2 or 3 codes about or calls for stroke and for heart attacks. And many patients with diabetes would present with advanced type of their conditions, even would require eventually dialysis because of the renal failure. And so therefore our initiatives were to assure the people in the Philippines that it is safe to go to the hospital. And that is the same assurance that we are giving for Guamanians who would come to the Philippines. So what do we do? What we did was to ensure safety of people going to the hospital. We involved in telemedicine and drive-through services, meaning to say, those people with chronic diseases, you don't have to go inside the hospital through their cars. There would be a queue outside the hospital wherein their blood could be drawn that will satisfy their monitoring for their chronic diseases like diabetes, heart diseases, and so on. And also, we employed a very strict infection control measures. Before you can even enter the hospital, then you're going to be monitored. You're going to fill up some forms for contact tracing, and nobody can enter not unless you have a mask, you have a face shield, and we provide adequate repositories for hand sanitizers. And every so often in the hospital, there is a reminder for everybody about hand hygiene, and observing physical distancing. We also provide separate areas for COVID patients and non-COVID patients. Emergency room separate, even elevators are separate. All the equipment are separate for COVID and non-COVID patients. And most important, for personnel who serve for COVID patients are different from those who are serving non-COVID patients. And more importantly also, we monitor, regularly check our personnel who are going to the hospital to screen them for the possibility of COVID infection, especially if they do not have any symptoms. So those are the assurances that we give to our patients.
So suffice it to say, if they are going to SLMC, they will be well protected from any COVID infection.
As a matter of fact, I used to tell my patients that the safest place to go is the hospital because everybody follows the indicated protocols. It's even safer probably in the malls wherein a lot of people are present and you cannot observe strictly the infection control requirements. So in the hospital, I go to the two hospitals every day. And so far, I did, well, of course, personally, I suffered from COVID last year during the initial part of the pandemic. But it has emerged and it has, we have improved into the management. I'm the living testimony that I survived COVID also. But basically, right now, COVID patients, especially if you're going to look into the reports in the officially, our total is about more than 530,000 already. But our mortality rate is very low, less than 2%. And our recovery rate is very, very high. In the hospital, we used to have about 100 patients at any one time being admitted for COVID infection. But now, this morning, the number of patients in Global City is about 20. In Quezon City, it's about 15. And not so many patients are admitted at the ICU. Very rarely do we accept them in the ICU because we have known better through the management of COVID. It has emerged into a better one. We initially aggressively do treatment that will prevent them to progress to develop severe conditions.
Beyond Our Borders is brought to you by the Bank of Guam and KFC.
Closing our Harmon and Dededo branches marks the end of a chapter, but we want to reassure you that this is not the end. It is us embodying the philosophy that founded us and still grounds us today. It's the reason why we are the People's Bank. It's because as times change and our community grows, so will we. So it's not the end. It's the start of something new.
Beyond Our Borders is brought to you by the Bank of Guam and KFC.
How would you say, how would you rate how the Philippines has addressed the pandemic so far, just countrywide?
Yeah, well, initially there were hiccups because not so many know about the transmission. Not everybody understood the public health implications of what we are doing. But we have learned a lot through that, and the proof that I think we are able to it is now on the decline. I think we have the curve of COVID infection. We have flattened the curve already, and because of stricter measures, once you develop in a particular area, then the local government unit do quarantine measures in their locality. And of course, swabbing and contact tracing form an important component on how to control this. And hopefully before this month, at the end of this month, we might be able to initiate vaccination for our frontliners. And hopefully, at the end of the first quarter or the beginning of the second quarter, we might be able to get more vaccines, and we will try to initiate vaccination to the general population. Of course, because of the limited supply of vaccines as of now, we try to prioritize those who are at risk or exposed to COVID infection. So we're going to vaccinate first the frontliners, doctors, nurses, and the workers who are exposed to patients with COVID. And then secondly will be the senior citizens who are at risk, high risk of developing complications from COVID. And after that, we will initiate the vaccination for Filipinos between above 18 years old up. So hopefully there will be enough vaccinations by the second and third quarter this year. So if that would happen by the fourth quarter of this year, maybe the restrictions will be loosened up in order for the economy to open up completely.
Yeah. Do you agree then with I guess the consensus is that it's really going to be the rollout of vaccinations that's going to enable a country to reopen its economy?
Most certainly, because there's a lot of misconceptions about vaccinations. People tend to look into anecdotal claims, especially now with the social media. But if you try to review all of the vaccines, what is the difference in all of the vaccine is it does not prevent the development of COVID, especially those who have to have mild symptoms. But all of the vaccines are consistent in trying to prevent the development of severe COVID infection and even prevent them from dying from severe COVID infections. And that is, I think, the most important benefit that should be stressed for everybody. It's okay if you develop some sort of cold and flu, which is also COVID infection is just like a flu, an influenza, a flu, because the mild form you have some cough, you have some colds, some low-grade fever, but you don't die from that. It is the severe complications of COVID that will be prevented by the vaccination.
Yeah. Can you talk a little bit about the mitigation measures that the Philippine government has implemented since the outbreak? Things like maybe closing off the malls to
Yes.
children and senior citizens, those sorts of things. What sort of challenges the government faced?
Yeah, we have to implement some bitter pills in order to control the infection, and certainly it evolves between varying levels of quarantine. A complete shutdown for those patients who have clusters of infection. Some areas had been closed completely away from no one can get in, no one can get out except for probably getting some essential supplies. Some areas, the local government provide the supplies to those people for about 2 weeks then. That's a complete quarantine. And then certainly once the people became aware of compliance to the measures like wearing masks, limited limit of going into other public areas, and avoiding unnecessary celebrations, because Filipinos, just like Mamenians, would like to celebrate birthday parties and so on and so forth. So when they realized that, we were able to curtail down the spread of the infection. And of course, limiting the travel of people had an impact on our economy. Especially, we also instituted limitation of mass transport system, because that is where infection do happen more frequently because, especially in the Philippines before the pandemic, public transport system is just like a can of sardines. They are packed together, very
Yeah.
closely to one another. And of course, economy suffered. Restaurants, a lot of restaurants have closed. Other business have closed. And hopefully, once we are able to control this through the vaccination, gradually we might be able to open completely our economy. But I don't think we might be able to go back to the old ways. The pandemic has taught us that, we really have to always remember some of the basics. You have to take care of yourself. You don't have to abuse yourself. You must have enough sleep and rest. You must eat health. You must follow healthful living ways. You have to always sanitize your hand whenever you touch a lot of all of these things. And all of those basic measures, probably we should adhere to them eventually, because even we are able to control this present one, a new one, you have to remember that these viruses could mutate, and certainly it might produce problems later on. We do not know the implication of that. So
Yeah.
what in St. Luke's, what we term is we're going to go to a better normal, not a new normal, but we would wanted to make it better for everybody. So our slogan here is we march towards better normal, not
How would
new
you
normal.
Beyond Our Borders is brought to you by the Bank of Guam and KFC. Beyond Our Borders is brought to you by the Bank of Guam and KFC.
How would you say the Filipino population in general has been responsive to the limitations that the government has imposed? Have they been fairly disciplined in your observation?
Initially, at the very beginning of all of these measures, of course, a lot of people would object to all of these things because a big percentage of our population are on a hand-to-mouth existence. That is why the Philippines spent a lot of money in trying to subsidize all of them, even giving them, just like in the US now, the $1.9 trillion that would include subsidy for those who are out of work or out of their job. Because you really have to do that so that they will stay in the place where they live, so that you try to control the spread of the infection. And sometimes giving them subsidy is not enough because especially the Philippines, we don't have that enough money. And if your economy has contracted also, then certainly the domestic economy has contracted eventually. So people have to adjust to it. But once they realize the importance of doing so, then the recalcitrant ones, or those who do not want to follow, they adjusted to it. And for my example, I found out that during the pandemic, I can do more than when it used to be before this situation. I can hold meetings through Zoom or Google. I spend more time now with my wife. I do not know whether this is better or but you tend to work on your garden, and you tend to do a lot of things together with your family. So maybe this is one way of God telling us to go back to the simple ways, the simple things, and appreciate them better. I think it's the positive way of looking at it.
Absolutely. You touched on it a little bit earlier, but how soon do you think the Philippines will be able to reopen to the extent where it would be people from Guam would be able to almost freely travel back and forth?
Hopefully, I think once we are able to vaccinate about 50 million Filipinos, because our population is 110. You have to vaccinate 70% of your population to be able to get herd immunity. But you exclude those population belonging to 18 years old and below, because we don't have any study on this subset of age wherein you will have to do vaccination. So basically, it's about between 50 to 60 million Filipinos. Once you have vaccinated that, then I think we might be able to completely open our economy to the usual. Travel probably will not be restricted. It will be open borders for everybody. And if there will be an ample supply of vaccines, I think by the last quarter of 2021 or the first quarter of 2022, we might be able to see you in Guam by the time. Pay your visit.
Beyond Our Borders is brought to you by the Bank of Guam and KFC. Beyond Our Borders is brought to you by the Bank of Guam and KFC.
We look forward to having you. What do you think are the biggest challenges, though, in that vaccination rollout? One of the things that's always mentioned is the fact that the cost of the vaccine, and there's a substantial amount of the Filipino population that may not be able to afford it. So the government would have to pay?
Yes. Well, it should be a cooperation between the private and the government. For some companies right now, big companies, there is an agreement with the government that they pay for the vaccination of their employees, so they order, but 50% of that order will be donated to the government. On our part, at St. Luke's, our board has made the decision that we are going to give vaccination to everybody at cost. We're not going to make business out of it, because this is a national health problem and we must do our part. So right now, St. Luke's, we have two hospitals, Quezon City and Global City. We have made arrangements with the local government in Quezon City and Taguig. And we will help the city of Taguig and Quezon City in the vaccination of the population with that area, because it will be a big logistical problem. Yeah. It's not that after you have vaccinated, people will go. We have to do observation, because all of these vaccinations are being given based on an emergency use approval. And certainly, you just have to watch out these patients between 15 to 30 minutes after the vaccination. So that will be where the holdup would be. And in our setup now, in our hospital, maybe because of the limited space, we might be able to vaccinate only about 200 to 250 every day. So the solution is we're going to put up vaccination sites in other areas. Just like in the US, they use the football fields or baseball fields for vaccination. So here in Global City, we are negotiating with the city of Taguig. A lot of the Guamanians will be probably familiar with the Mine Museum. That's a big space wherein the management of Mine Museum had consented to use that as a vaccination site. And also, we are doing programs of doing the vaccination for our partner companies. In a company here within the vicinity, we can send up a team and then they provide the space, and then we do the vaccination. That we bring the people who would do the vaccination and the screening and the observation period after the vaccination.
Yeah. And finally, last question, Doc. Most countries in the world are trying to get these vaccines. How about the Philippines? How about access to the vaccines in the face of all of this competition for it? And what would be this? Where will be the source of those vaccines?
Yeah. Fortunately for the Philippines, we have good relationship for those countries that manufacture the vaccines. I think through the COVAX, which is being led by the WHO, we're going to get vaccines from Pfizer and AstraZeneca, and also vaccines from Novavax. This is being manufactured by an American laboratory, but the mass production of the vaccines will be done in India. And certainly one big company in the Philippines will bring it over in here. We also get a lot of allocations coming from Moderna. I think all in all, we might be able to get about 40 to 50 million vaccines. That will be enough. That will not be enough, because if it is 50 million, that is only for about 25 million Filipinos. But in the last budget, the Philippine government has allocated 70 billion pesos for the vaccination. So that's 70 billion pesos will be enough for 70 million Filipinos, because 70 billion is about 1,000 pesos for each and every individual for the complete vaccination. Yeah.
All right. Good luck with that. I hope that comes through very quickly. And final question for you, Doc. What's your message to your hundreds, if not thousands, of patients on Guam?
Well, our final message is we will never abandon Guam in terms of giving them the essential medical services that you require. And that's why we're doing all of this, to be able to bypass all of the restrictions because of the pandemic. And this is the start. And hopefully, once we were able to prove that this is very effective, then we can accommodate more patients from Guam, because after people from Guam would have applied for the Philippine visa, we will take care of everything. We will facilitate their arrival at the airport. We're going to fetch them. We're going to do the swabbing in here. They're going to be admitted. We converted one part of the hospital as a quarantine area for them, so that they don't have to go from one hotel to another. And if their swab is negative, after 5 days, they can roam around. And of course, this is for companions of patients, but for patients, immediately they're going to be attended to. So we will never abandon Guam, because we love Guamanians.
All right. Thank you very much, Doc. Dr. Arturo De La Pena, who is the president and CEO of one of the Philippines' top hospitals, St. Luke's Medical Center at Bonafacio Global City. Thank you so much, Doc. Appreciate your time.
See you soon. See you soon.
All right. I'm Nestor Licanto. Thanks for watching,
have a nice
everyone.
Weekend too. Yeah. Thank you.
We'll see you next month on another Globe Beyond Our Borders. Thanks for watching, everyone.
Anytime. Thank you.
Beyond Our Borders is brought to you by the Bank of Guam and KFC.